there's a concept called pre-aging, right? Where we are starting to use dermocosmetics or cosmeceutical products earlier and earlier in life in order to extend longevity, but also to stop the symptoms of aging, right? If we think of aging as a disease, then we are trying to stop or delay them as much as possible. Would you recommend that DHM be used in both the population that already has methylation on their DNA? So in other words, those who either through intrinsic and or extrinsic aging need the demethylation, or do you think maybe it's both? Do you think that this product should be used for those who are young in order to prevent that bad methylation?
This is a very good question, I would say, and it would be really, really nice to have even more studies on long-lasting effects. So
Right.
far, we looked at time points which are 4 weeks or 8 weeks after starting our treatment with DHM, but we do not have really long-term studies. This is something I would definitely go into also in the future to see how far we really come, and also looking at the consumer range. I mean, so far, of course, we when we started to set the fundament of and the basis of the epigenetic research, we looked into age-dependent changes, which means, of course, we looked at younger people and also to mature skin, and tried to divide those also into groups. But the question is, when is mature skin really starting to be mature skin? This is a question we haven't answered yet, honestly spoken. But what we can see in our clinical study is that starting, I think, with a consumer age from 40 years on, that we do not see any age dependency in the response to DHM. So it makes no difference if you start within your 60s or your 40s, you would always come to a reduction of the biological age. So from my perspective, I would say it makes definitely sense to start early on,
Mm.
but it's also never too late, I would say.